Hi, thank you for joining this episode of the APAPP podcast. My name is Emily Simmons. I am a pediatric nurse practitioner in Chicago, Illinois at Ann and Robert H. Lurie Children's Hospital of Chicago. I also have the honor of serving as co-chair for the pediatric section of APAPP. And I'm here today with one of my colleagues from our children's hospital, Lauren Witt, and she and I are going to look into the adult transition program that she and her team have created for our hospital and the success that they have seen in helping pediatric patients, specifically in the rheumatology division, transfer from pediatric care to adult care. Lauren, I'll let you introduce yourself and then we'll talk about your program.
Thank you so much, Emily. Hi, my name's Lauren Witt. I am a pediatric nurse practitioner at Ann and Robert H. Lurie Children's Hospital of Chicago in the Division of Rheumatology. Thank you guys for having me. I'm so excited to be here.
And you may say, well, what does rheumatology have to do with pulmonary disease? And there actually is quite a bit of overlap. We do take care of a lot of kids from rheumatology in pulmonary and vice versa. But today we're going to talk about the transition program because I think that is something that no matter what kind of practice you're in pediatrics, we face this great dilemma of when do we transfer pediatric patients to adult care? How do we do it? How do we reach out to our adult colleagues as our teenagers become eligible for adult care? What made you decide to create a template or a pathway to help our pediatric patients transfer?
So when we were looking at the data as our patient population as a whole, and I'm sure pulmonary as well as other divisions can relate to this, we were having a very high bounce back rate. So patients that were supposed to be transitioned to the adult healthcare systems were ending up back in our clinics, in our ERs, and subsequently being admitted. And so we did not have any infrastructure prior to my implementation of a clinic for transition. And we were seeing that there was just such a need for more support, more education, and allowing for more tools to hand to our patients to be able to advocate for themselves, take ownership of their health care, and be able to successfully transition and stay within the adult healthcare system once they do actually transition.
You mentioned that you have data that helps you guide the process. What point do you and your team start saying we need to start preparing our patients for transition? Is it 17, 18 years old, or do you have an age that you've identified that is appropriate to begin the transition process?
So that's a great question. So I'm so glad you asked that. So literature tells us that we actually should be starting at 12 years of age, which sounds obviously very young, but the data tells us that the earlier we do this and the more often, the better we prepare our patients. When we're waiting till 17, 18 years of age and we bring up the conversation of transition, there's a lot of fear, right? And so the process is usually much quicker by that time because they do need to transition because of their age. And when we do that at 17 and 18, they feel like we're almost throwing them to the wolves. Like they've never knew that this was going to happen and they feel very lost in the process and they almost lose trust within their their teammates because they have built such a strong bond with their providers. And all of a sudden now, they need to find someone new. And so in my division, we didn't want to start at 12, but we do start at 14 years of age. And so we start having them come to my clinic at 14 and we do a longer transition process. So I see them about twice a year. We go over education pieces, both about their disease process, the medications they're taking. We talk about how do you refill medications? How do you use a Walgreens app or a CVS app, for example? How do you call to schedule appointments? Can you do it on my chart? And also trying to make the adult healthcare system seem more relatable to them. Because in retrospect, when it comes to refilling medications and scheduling appointments, that system typically is the same. And so that brings them some reassurance. And so we build on these skills time and time again from 14 until they transition about 18 years of age in our clinic.
How do your families, when you start having these conversations saying, you know, we want to talk to your family, but to your child at 14 about taking ownership of their healthcare and understanding how they're going to become an independent adult in charge of their own healthcare? How do your families respond when they say, we want your child to refill the prescription?
So that is definitely, it's a two-way education, both for the patient as well as for the families. Even our 18-year-old patients that I see, or sometimes even older. My oldest patient right now, I think, is 25 years of age. So we have a big span. And no matter what the age is, it is very difficult, not only for the patient, but for the families to kind of take a step back and say, wow, my child is going to actually have to do this. And I think speaking as a parent myself, it's really hard. We want to help our children do anything that they need to do, especially when it comes to their medical care. And it's really difficult for them to be able to do that, though, if we're always doing it for them. And so we start very slowly. Usually the first discussion is, who does refill your medications? And I would say the high 99%, it's going to be either the guardian or the parent. And so we talk about not right away kind of cold turkeying you doing it yourself, but I want you to be present for the next refill. I want you to be with whoever the guardian is or your parent is when they call. I want you to know the phone number. I want you to put it in your phone. And we take steps in that direction. So eventually they do it on their own, but we do it in a very stepwise fashion so it doesn't feel overwhelming to the parent and it doesn't feel overwhelming to the patient themselves.
So when you have this patient who is ready to transition, do you provide the patient and family with a list of adult providers, or do you call and schedule the appointment for them? How do you make sure that that transition is successful so that way they don't bounce back to the emergency room or back to your office?
Yeah, so that's a great question as well. What we typically do in my clinic is, one, part of taking ownership of your healthcare is navigating the insurance piece. I do have a running list of providers all over Illinois and also disease specific. And so I usually have someone in mind or a couple people in mind because, one, I want to get to know the patient themselves. Not everyone is a good fit for everyone. And so I really get to know a lot about them. What are they doing? Are you going into the workforce? Are you going into school? What are you going to school for? And so based on that, I start to kind of get my gears working of, okay, I really think this provider would be a good fit. They understand the disease process. But typically, no matter if I have someone or not, I still have the patient call their insurance company to be able to understand how to navigate that. And then part of their homework that I give them is to provide me with that list that their insurance has provided them. And then we go over it together. And then we talk about things that are important to them, such as, do you want to stay closer to home if it's possible? Do you want a major medical institution? Do you have other subspecialties that you are going to be transitioning to this center as well? And then as we kind of navigate the process, then I, again, have them call to schedule the appointment. And I have a follow-up system with my nursing team where they typically allow the patient a week to a week and a half to be able to call for that appointment. We then check in and say, did you call to schedule that appointment? When is the appointment? Or if not, okay, I would like you to do it. I'm going to check in a couple more days. So we keep the process going. Once they make the appointment, we then check in again to make sure that they went to the appointment. And then after that, I actually see all of our patients for a final, I guess, visit, so to speak, where we go over, how was the appointment? Do you feel like the provider listened to you? Was there anything that you needed more support with? Do you feel like it's a good fit for you, both location, personality-wise? And then if it was a good fit and they don't have any needs, then they officially transition over and they continue care in the adult sector.
I know we just have a few minutes left, but in the last couple of minutes, will you talk about how, if someone wants to create this process in their practice or their institution, what they might consider starting, what barriers they might consider, and how they can implement what you've done, maybe on a smaller scale in their own practice?
Absolutely. So first and foremost, and I talk about this in my presentation, is having a team discussion. It is so important that everyone on the team understands the importance of the transition process. You want to have uniformity within your team and you want to have consistency. What you are discussing in your clinic needs to be mirrored in everyone else's day-to-day conversation at their primary specialist. And so it starts with a team discussion. And then from there, you get to build on all of the things we've talked about. What age do you want to start? What age do you want to transition? How often are you going to see them so that you guys can build it together? And then after that, you absolutely want to be able to address your barriers. And so some of my barriers within my clinic were lack of social work support, no previous networking with any adult providers, and then just general team support, because it is difficult in the beginning to gain traction for what you're trying to do. And so I encourage you to write down a list of everything that you think is going to be a strength or that works for you. Mine is my nursing staff, my administrative team, and things that are barriers like ours has, so that you can address them to be able to be most successful in your clinic space.
And I know you're presenting here at APAPP 2025 tomorrow with a colleague of yours who helped create the transition practice for your division.
Yes.
What key takeaways do you hope that attendees tomorrow will leave from your presentation?
I hope that they take away that anyone, no matter how big your patient population is and your team is, or how small, that you can implement this into whatever scale is appropriate for your team. I personally did a telemedicine platform for that reason, is that we have a very high no-show rate. And so I was able to see patients and meet them where their needs are and be able to do the transition process, but they don't have to come see me. If your patient population works better with an in-person, then absolutely do that. You can customize this process to exactly the needs of your patients and your team. And all you have to do is get the ball rolling and say, we're going to start this. Let's have a conversation about it.
So I would encourage anyone who's interested in the pediatric to adult transition process to come to your session tomorrow. And then also consider joining us next year for APAPP 2026, because this is a topic that I think will continue on from this year, even into next year, as we get adult participation and as we continue the pediatric to adult process. I anticipate this will be something that is taken into next year's conference as well. So thank you, Lauren, for your time.
Thank you for
being
me
here.